Good day and great health. My name is Dr. Sarka of Ohio Specific Chiropractic. I'm a pediatric, family wellness, and upper cervical specific chiropractor. Today on this video, we're going to talk about the connection between motor tics and the upper cervical spine. Now, my disclaimer at the start of all these videos as a chiropractor to let you know that my goal and my objective is not to medically treat the symptoms or conditions of the body, but to help promote the functional integrity of the nerve system at the brainstem level. So now, in order to delve deeper into that connection between the upper cervical spine and motor tics, we're going to do a simple crash course in anatomy and physiology. In the upper cervical spine, we focus on four main structures. We have the occipital bone found on the base of our skull, the atlas bone or the first cervical vertebra, the axis bone or the second cervical vertebra, and then going to be housed and protected by those three bones, we will find the brainstem area of our nerve system. Now, what's unique and important about our brainstem is that it is the connection area between the brain above and the body below. It has the greatest concentration of nerve fibers found anywhere in our body. Now, along with those four main structures, we're also going to focus on two other structures of our nerve system, the basal ganglia and the reticular formation. The basal ganglia is a collection of a few different nerve cell body areas that are going to be structurally found right above or superior to the brain stem. Now, what's important about the basal ganglia is that it's going to be involved in the inhibition of unwanted or involuntary motor actions. It's also involved or helps assist in movement fluidity, also helps assist in habit formation, reward reinforcement, learning patterns, and emotion. The reticular formation is going to be found primarily in the brainstem, and its main function is to help coordinate and synchronize information from the brain above to the body below. It also helps assist in cognition, consciousness, and communication. Now, what's unique or important to understand about the basal ganglia and the reticular formation in the brainstem in general is that they are both involved in connecting higher brain areas to lower brain areas and ultimately then to the body down below. It's somewhat of an antiquated term, but they are very analogous or similar to a switchboard operator, and the fact that they are taking information from different areas of the body and the brain in order to then collect that information to then pass it off to where that information needs to go in the brain and or the body. Now, when we talk about the nerve system in general, it does four main functions. It controls all the movements we make. It's going to sense everything we feel. It's going to regulate all our body organs, and it's going to relate us to the outside world. Now, stress, though, that is going to be constantly coming in contact with our body is going to affect nerve sensitivity, perception, and behavior. There are three major types of stresses that we come in contact with. They're going to be physical, chemical, or emotional in nature. Now, one job of our brainstem is to help adapt our body and our brain to these stresses in order to help maintain homeostasis. This is so then our nerve system and the current or the flow of the information can be at ease, and so that our spine can also be at balance. This is a very important aspect of the connection between structure and function, which is a very important aspect of our health. So then this can mean our function, our health can be optimized. So then that ultimately means our health can be optimized as well. Now, if our body and our brainstem can't adapt to a stress at 100%, compensations do start to arise in our body. One specific compensation that happens in the upper cervical spine is a vertebral subluxation. A vertebral subluxation is a physical presentation of a compensation occurring at the brainstem level. What's going to happen is that the upper cervical spine, the atlas and the axis bones, are going to be locked in a misaligned position. Now, once those bones shift and become locked in a misaligned position, they start to put added pressure and irritation on the nerve system, especially at the brainstem level. What this means then is that locked spine is going to start to perpetuate spine imbalance and nerve tension. This, over time, can lead to abnormal sensitivity, perception, and behavior of the nerves involved. This means then we have a brain-to-body disruption happening specifically at the brainstem area. So So again, remember the brainstem is has the highest concentration of nerve fibers found anywhere in the body. It's the connection between the brain above and the body below. So if we have a disruption in the flow of information happening at the brainstem, we can ultimately have a disruption in the information of our nerve system happening anywhere in the body. Now over time, this presence of this brain-to-body disruption can lead to a wide array of symptoms that can happen in our body. Now when we talk about motor tics, some of the more common symptoms of motor tics are going to be quick, jerky movements, head twitches, shoulder shrugs, eye blinking, face grimacing, sticking the tongue in and out, certain gestures and gyration movements. And the thing with all these actions and these movements is that they're all going to be uncontrollable and or involuntary, meaning the person has no conscious control of these movements. Now, if again we look back on the basal ganglia and the reticular formation, we can see if there's a disruption or some type of interference happening at the reticular formation and the basal ganglia, it can be incorporated into being very causative or connected to these motor tic symptoms. Again, the major ones of inhibiting unwanted motor actions, movement fluidity, habit formation, sort of reinforcing learning patterns of motion, and then also too in our reticular formation, which his main objective is to help coordinate that information above happening in the higher brain areas, and also helps assist in consciousness. Now, as a chiropractor, my goal is not to, again, look at these individual symptoms and try to treat these symptoms with some type of drug or surgery. My main objective as a chiropractor is to locate the vertebral subluxation at the upper cervical spine, which is creating a spine imbalance and nerve tension at the brainstem level. We do that we correct that spine imbalance and nerve tension by adjusting the vertebral subluxation. Once we adjust the vertebral subluxation, that means our nerve system has a greater potential to function. This means then we are decreasing abnormal sensitivity, perception, and behavior of the nerve system overall, which means then our brain and our body have a greater capacity to communicate with. So we are then reducing that brain-to-body disruptions happening that can happen over time. Now this is just a quick primer in the connection between motor tics and the upper cervical spine. But if you have any other questions or concerns, you can reach me on my website at ohiospecific.com. Thank you very much.